Greetings, this is Candice Stroh, Senior Program Manager with Center for International Medicine at City of Hope. Thank you so much for a great first session, Dr. Miguel Anderson and Dr. Taylor. Thank you very much again for a very engaging discussion for the first session. Thank you so much, Dr. Taylor. And now please allow me to introduce our next session, Elevating Global Oncology Capabilities Through Direct Patient Services and Institutional Collaborations. And allow me to introduce the chair of our session, Mr. Ed McCarthy. And Mr. Ed McCarthy holds healthcare policy and management from Harvard University. He has dedicated more than 30 years of his career in international collaborations, and he joined City of Hope in 2015 in leading our international collaborations and efforts at City of Hope. So, to Mr. Ed McCarthy.
Thank you, Candice. I appreciate that. Good morning, hello, everyone. That was a wonderful first session, and I want to offer congratulations. Maybe the session isn't over yet, but I think that first session deserved a great deal of praise. It was wonderfully presented by all participants. And thank you to Dr. Ogembo for organizing this event, and we're very grateful for the opportunity to be part of it. So this session is going to be a little bit different in that we've organized it as a panel discussion. Okay, and we're going to focus on two things. Essentially, our session is focused on two ways of improving global oncology care. The first being direct patient services, or what we think of as one patient at a time. We have a program that's built to attract and to take care of patients who are in need of good cancer care. And the second is through institutional collaborations, where the goal that we seek is to expand our impact through education, through training, and other forms of capacity building with healthcare organizations abroad. So our panel then, as you can see on the screen here, we are very, very happy that our good friend, Dr. Sergio Araujo, who is the director of the Cancer Center program at the Albert Einstein Hospital in Sao Paulo, Brazil, is here to join us. And that is something valuable to us because we're going to focus not only on what we do with individual patients, but what we're doing together with the Albert Einstein. And then we have Dr. Linda Bosserman, who many of you already know. Linda is a professor in the Department of Medical Oncology and Therapeutics Research here at City of Hope, and also our medical director for international medicine. And lastly, we have Roxanna Mann, who is our senior director for international patient services. And I think we can kick off then with the first question. So I think maybe it would be a good idea to define exactly what it is the Center for International Medicine does. And it's probably a fair assumption that most people would think of us as the door through which international patients come for treatment at City of Hope. And while that is certainly true, it's only part of the story. And so I wanted to make sure we have a solid point of departure when we talk about international medicine here at City of Hope and what it does. Perhaps, Linda, you could comment on the breadth of activity that we engage in here at City of Hope, and maybe even diffuse a potential misconception that for some people, the assumption is that international medicine is a concierge program for wealthy patients. What would you say to that?
Sure, it's just an honor to be part of this incredible conference. We have an amazing team that really is here to promote City of Hope's idea to democratize cancer care. We serve all patients, not just those who may be extremely wealthy. So we have several offerings that connect through the International Medicine Program that we'll talk about in a little more detail. But the most important is that we are here to provide the expertise of our faculty to those in other countries. Primarily, we're serving those in China and Latin America, expanding to Mexico. But we're here to serve patients, to help them with their physicians in their home countries as well, find the best cancer workup and treatment. And some of that may be done at City of Hope through clinical trials or through treatments that may not be offered in the home country. But most of those patients have some type of private insurance. Most don't come just paying cash. People either have insurance or obtain insurance, but we treat a wide variety of people of financial backgrounds, and we welcome them and really facilitate that through international medicine, through translation, helping organize transportation, understanding what the services are, understanding working with the multidisciplinary team, and often connecting to the patients, physicians back in their home country. So we have an array of services, and we don't have preference. We treat everyone equally when they come for services, and everyone's treated as if they are our most special patient, which is our philosophy of City of Hope.
Very good. Let me ask Roxanna to dive into the services we offer to international patients at a little more granular level. As I mentioned, patient services at CIM is about taking care of one patient at a time, but that also means their family typically. Can you describe, Roxanna, what it is we do before, during their treatment, as well as after they return home to support these patients?
Yes, first thing we do is create awareness of City of Hope excellence in places who may not be known. Through these efforts and events, marketing campaign in specific countries to promote our medical capabilities, such as posting Spanish language City of Hope stories on Facebook, targeting medical readers. Another example, most people will be surprised to learn that we have over 50,000 WeChat followers in China who are able to follow and read about City of Hope care and research in Chinese. Outreach events such as Spread the Hope events are done here for the audience living in local communities. We also collaborate with a few reputable medical travel agencies, hospitals, and insurers to offer remote second opinions, precision medicine testing, speaking engagement for our faculties. We are sharing City of Hope stories and news in multiple languages. Once the patient reaches out to inquire for treatment, our team begins the intake process. We understand that cancer treatment is a complex journey, and it's a journey involving the patient, family, caregiver. They encounter many challenges, feeling lost and stressed. Imagine traveling to a foreign country for the first time. You're not familiar with the location, not knowing how to get around or communicate, and not sure where to stay or to shop. These are the barriers international patients encounter. Hence, our CIM patient team embrace and support patients and their family to ease the anxiety. We answer questions from the initial inquiry. We also understand they need hand-holding and reassurance. So it's about the right diagnosis for the right treatment at the right time. As the initial intake process began, our team abstract the clinical information and connect with our City of Hope physician for review. After our specialty MD reviews the case, we share the information with the patient, develop a cost estimate, or we also obtain an initial insurance authorization for the patient. Our international patient navigator right away coordinate detailed logistics. We bundle appointments, scheduling the clinic scheduling that make clinical sense. Recently, we have a patient with an urgent lymphoma diagnosis, complicated by underlying comorbidity in cardiac, diabetes, and liver issues. Our navigator reached out to cardiology, endocrine, and hepatic teams, bundle appointment for multidisciplinary consultations. As we sequence these multiple schedules in advance, necessary consultations and diagnostic tests were done so that there's no time wasted or delay for patients to start treatment. Pathology review is also required here to confirm patient diagnosis. Our pathologists are specialized with expertise in molecular and precision medicine. In the US, we have issues with access, equity, and disparity. These issues are even more extreme in countries across the globe. Cancer patient faces difficulty accessing latest technology, skills, trained support, lack of treatment options, additional disparity due to governmental policy or restrictions, and support for cancer research. Awareness and cultural belief about clinical trial. Let's talk about traveling at the right time. When patients reach out to us, they can be at various stages of their cancer journey. Sometimes they are newly diagnosed, they haven't received treatment, in treatment, or just recently relapsed. There are only a small window for the evaluation for clinical trial, bone marrow transplant, or cellular therapy. Our team works closely with our City of Hope physician, the local treating physician, involving the patient and the family, fine-tuning the right time for them to travel. And the same for our aftercare. As the patient completes their care and return home, we continue to stay in touch and provide support. Our CIM team also support US patients who are living in another country, needing to transfer back for care at US. For example, a patient working overseas or visiting another country when they diagnosed with cancer. And this involves a very complex logistic and detailed planning. Our CIM team works with many internal City of Hope departments. During the pandemic, we have orchestrated an acute leukemia patient travel from a hospital over 6,000 miles away, close to 20 hours flight time, crossing 3 continents, and arrive safely to be admitted to a life-saving treatment at City of Hope.
Are there both medical and then non-medical challenges that these patients face, Roxanna, and how do you help them?
Yes, when patient and family travel to City of Hope for treatment, finding someone speaking the language, able to live in a safe city, eating at local restaurants, shopping at a grocery store, able to find food or ingredients, remind them the taste of home is very comforting. Another scenario, one of our patient's brother is a M.H.A transplant donor who was having difficulty getting a visa to travel here. Our team wrote multiple letters, and our physician also advocated the situation by contacting government officials so that we can facilitate the brother's visa approval. And he finally able to come to US in time, and the patient have a successful transplant with his brother was a M.H.A donor. We want to get to know the patient and the support system because some patients do travel with a whole family. We teamwork with our supportive care colleagues, providing a holistic care. And we have patients that come here with child life specialists helping a patient that with young kids or pediatric patients needing to attend school while they're here undergoing treatment. At City of Hope, we emphasize precision oncology, early cancer detection, and prevention for the family. We offer genetic testing for all our patients, and our genetic team evaluate patients for personal history and family cancer history, and completing those germline tests. And if a familial cancer risk is relevant, we would suggest family member to receive genetic tests and counseling, then with a specialist consultation, intervention, and follow-up, so that cancer can also be prevented and detected early for the family.
Very good. Thank you. Let me get Dr. Sergio in here for a moment. The Albert Einstein Hospital is, for many of you may already know it, but for those who don't, is a very well-regarded hospital. It's probably been the most highly regarded hospital in Latin America for the last dozen years or so, maybe longer. So it's a large multi-hospital system as well. But because of its breadth of services and the high quality that's offered, it does attract a lot of international patients as well from outside of Brazil. But Dr. Sergio, you've heard a little bit about what we do for international patients here. In your experience at the Einstein, what is similar and what might be different?
Perfect, Ed. Hello, how are you? Good to see you, Roxanna and Linda again. And thank you for having me here. Yes, we are a premium access hospital in a 40 million inhabitants city in the southern region of Brazil. As you know, there's a lot of inequality and disparities to health access here in our country and all over South America. We serve a lot of patients from South America through an international support center. And these patients come to Einstein mainly because of some of our specialties that they would be for sure cardiology, oncology, and minimally invasive surgery. Many of health systems in South America countries, they don't have access to the medicine that we do here at Einstein. In other words, we are at this very campus that I'm speaking to you, a very restricted system to most part of Brazilians. Although we have a presence in our public system. In spite of this duality in our health system, patients from foreign countries seek us to because of these specialties. We receive patients mainly from Uruguay, from Colombia, from Bolivia, and even due to cost estimates for treatment in the US, some patients, but not that much, from Mexico. We have a structure for our international patients pretty similar to what Roxanna has shown. It all starts with mainly a virtual consultation, a virtual office consultation, and then it comes to cost estimates. We tend to be agile, but I'm sure we are not as agile as we would wish. And visa issues is not, thank God, is not a problem here in South America, because patients then don't need visa to travel within Mercosur, right? And I think regarding, and there is a lot of referral due to between physicians in other countries and our physicians, because I may not have said, but we are a open staff hospital in every specialty except for oncology. But for medical oncologists and radiation oncologists and every other physician in our system, they are open staff. It means that can do medicine in other hospitals, including our competitors. So we struggle to serve two clients, physicians and the patients.
Good. Thank you. Dr. Bosserman, I want to go back to you. And you've heard me from time to time describe international medicine as kind of the State Department for City of Hope. And that may be a bit of an overstatement, but there are some aspects of it to it that are relevant. I mean, we facilitate trade, we conduct foreign relations, so to speak, in a general way. We're about encouraging, as you mentioned earlier, the expansion of the City of Hope mission abroad, right? Can you lay out, now that we've talked about international patient services as kind of the foundational piece of what we're doing, what additional types of programs and services we engage with other institutions around?
Sure. So, as we talked about, we do direct patient care for those that are able to come, whether it's for clinical research or specialized treatment for a part of their treatment or the entire course. But we also offer remote second opinions. And one of the privileges of having access now with various formats is that we can reach out to other countries, to physicians and patients, to give advice and work with them, often on the best treatment plan, clarifying their workup, their diagnosis, or different specific regimens to really give patients confidence and to really review the latest information that really helps their doctors, who are often seeing many kinds of cancers or many different patients, and really we partner with them to provide that expert oncology expertise. But in addition to that, we offer education and training remotely and on campus. So for instance, with our amazing partners in Brazil at Albert Einstein, we offer fellow observations to come for 1 to 4 months and work directly with faculty in the clinics, doing a research project, attending conferences. Hopefully also we offer social, getting together, really building collegial relations that aren't just about the experience here, but really a lifelong relationship that we can call on each other and work remotely together. So we have the observations, we have an entire genomic training program that people can participate in remotely. Some of that can be involved coming to campus, but it's not required. And then we have ongoing conferences for genomic counseling people can learn from. And we also offer specific tumor boards, so breast tumor boards, lung, myeloma, different tumor types, where we bring our expert faculty with our collaborators' expert faculty and all those who want to attend to discuss cases at a high level. We have a terrific tool, our OncoLens tools, where the data can all be submitted and reviewed. We can bring the specialists together either real time or asynchronously to help guide and really share information, as well as specific patient treatment recommendations. Then we also offer WebEx training programs. There was a remote precision oncology training going on this week between our collaborators in Brazil and City of Hope and others. And some are on site and some are here in the United States. And we're able to really do conferencing now and share best practices, learn from each other, especially in genomics, which can be quite different for different populations, different regions, learn new mutations, learn about new variants, and really share research opportunities together. So these are an array of offerings that we have available in partnership with our collaborators, as well as physicians who are able to reach out and do second opinions, which are primarily from China or Latin America and evolving into Mexico and other parts of South America. So really very distance learning as well as direct care, with the idea of sharing the privilege of where we've gotten to train, the ability of our faculty to be super experts on the cutting edge, and how to get that information out to those who really need it and those who can collaborate, as well as to learn from them, because our colleagues are also quite amazing and knowledgeable in their own right with specific resources that we can learn from as well.
Thank you. Roxanna, let me go back to you for a moment. With the pandemic, we had to make some adjustments, whereas much of what we had previously done relied on patients traveling to the United States. That became very difficult, and it certainly had an impact on the volume of patients coming in. That has since begun to reverse itself. But it taught us that we needed to be better prepared and able to engage at distance, right? And can you describe for us how serving international patients has been helpful in preparing to deliver services in a collaborative framework, for example, with the Einstein?
Yes, our multidisciplinary tumor board case review workflows are similar to our processes when we triage international patients or conduct a remote second opinion consultation. For example, our tumor board with our Albert Einstein team involving in-depth genomic pathology, radiology reviews, precision oncology discussion around complex cases. So recently, we actually have a patient whose case was presented and discussed during our tumor board. Molecular pathology review discovered a switch of protein receptor, and turns out this finding results in a new treatment for the patient. She then traveled here and completed her consultation with our oncologist. Now this patient is having new hope fighting her cancer because of new treatment.
Dr. Sergio. Collaborations are nothing new for the Einstein. You've been collaborating with other institutions within Brazil and outside Brazil. Can you tell us a little bit about that? What are the similarities and differences, particularly as they relate to oncology?
Yeah, you said that, Ed, when you were here in São Paulo with Roxanna. I remember that you said that we are very creative about building relationships. That's true. Since we have a nexus here at Morumbi, at our main campus, that's less than we would like. There's a lot of relationships that we try to build. For example, there are other competitor hospitals here in the city of São Paulo. We are a city of 40 million inhabitants, and there's also other philanthropic excellence hospitals. One of them is we are a hospital from the Jewish community, and they are a hospital from the Syrian community here in Brazil. However, they are general hospital, and they are mainly specialized in cardiology and interventional cardiology and cardiac surgery. And they wanted to develop oncology for years, since they have become a general hospital. What did they do? Well, we initiated conversations in order to be part of their operation without constructing a new enterprise, without building a new enterprise, not even in the paper. So we have an agreement of service delivery. What we do? So we did send some of our medical oncologists to their hospital in order to transfer our quality and safety initiatives. And as a result, we have a participation in the revenue provided by the referral of patients that do not have access to our institution, because they have a broader access profile and we have a very smaller one. So patients who do not treat here, they are not able to do it out of pocket or through insurance cover. We send them to this partner. So they are seen there according to our pathways, to our standards of practice, and they do the treatment there, and we share some of the revenue. It's a win-win system because it's good for patients. Many of them had their first consultation here, but they cannot treat here. So they are treated there with part of our staff. We assure that by some way that they are receiving what they would receive here at Einstein. And we have some sharing of results. This is going very well because it enables us to see more patients. It enables our physicians to treat more patients that otherwise would not be treating here, and enables them to grow in oncology. So for sure, it might be a partnership that won't last indefinitely, but it might work for some years.
Remarkable. And that's with the primary competitor in the Sao Paulo market, right?
Yes.
Very interesting. Okay. You've also done partnerships with what I would call public-private type partnerships, right, with the city?
Yes. Our partnership in the public system, guys, here in Brazil means everyone, regardless of paying taxes. Then we are 220 million Brazilians, and close to 50 million have access to insurance. Our primary health system is called Unique Health System. It's like UHS, and it is free and it is universal. For sure, it has a lot of good things and a lot of bad things, but the majority of Brazilians, they use this system. What happens in the city of São Paulo? Hospitals affiliated to the universal health system, they might be from the municipality, they might be from the state, or it might be from the union, from the central government. Here in São Paulo, we have a partnership with the municipality running their largest cancer center in the city of São Paulo. So what happens there? It's called Hospital Vila Santa Catarina, and everyone there is hired by Einstein. So physicians, multi-specialty teams, multidisciplinary teams, multi-professional teams. So everyone there is an employee of Einstein. So our badges work there as they work here. And we do treatment regarding surgery, radiation therapy. As a matter of fact, radiation therapy, these patients from the public health system, they do here at our main campus. So we don't have to build a bunker or to put a LINAC over there. But chemo, consultations, diagnostic medicine, interventional and precision medicine, as much as we can, they are all conducted there, and we have robotic surgery there. So it's a system that works. And there is another partnership that we can deliver services within the public health system that derives from the condition that we are a philanthropic excellence hospital. It means, for example, our liver transplantation program is run using this method. It means that some of our taxes are directed to run health services, and they are strictly audited by the federal government, by the Ministry of Health. So we have two ways of partnering with the public system. One is through an alliance with the municipality, when they send the money, the funding, and we hire everyone, and we do all the services. And the other is that we do all the services, we are audited, and we do not pay part of our taxes in order to do this health action.
Remarkable, thank you. Why don't we talk now about the relationship that we've been building together between the Einstein and City of Hope, and perhaps you can describe, at least from your perspective, what was the motivation behind doing this, and then we can talk about how it's going so far.
Perfect. Yeah, the internationalization of the oncology division here at Einstein is antique. It started in 2011, and we had another partner in the US. We built our oncology division according to their guidelines, and it was good, very good. We trained some of our physicians there, of our medical oncologists mainly. As a matter of fact, we have full training of 4 medical oncologists during all these years. However, as the time passed by, and some of the activities that we are now joining together, they kind of deteriorated. It means some of the international tumor boards, we could not count on these or the other physician, that since they did not have agenda. And then we started looking for another institution, and we met you. We found you, which was a very pleasant, not surprisingly, but very pleasant experience. You guys might have seen some of the pictures of our visit to Duarte, and we were all amazed and happy. As a matter of fact, we were euphoric during our visit, because we saw there that City of Hope started as an initiative from the Jewish community too, and the mission and the vision, and you can see here is our in the picture at your left, it's our president and our CMO. They are all with me, and our right is our entire delegation. We saw an alignment of objectives with you, and we started doing a partnership that we are fulfilling completely. Like, our physicians are training at City of Hope. They are currently training at City of Hope. Our multidisciplinary tumor boards and molecular tumor boards are happening, and everyone is excited here at Einstein. At this very moment, Dr. Stephen Gruber, which is the head of your precision medicine, precision oncology division, is with us. We had dinner tonight. He's a very nice man, a very nice physician. Everyone loves him here. And he had a couple of our physicians with him. As a matter of fact, one of our physicians is moving to San Francisco, but it does not relate to you. We suspected of that, and we would not be angry, but her boyfriend lives at San Francisco and she's moving to the US. It will be very good to her. And so everything is happening. We are signing a contract. As a matter of fact, part of the time that we work together, we are executing our activities, and part of the time we are expanding our contract, which is very good to us, because from each interaction that we have, we see an opportunity of partnering, and we are very proud of that. And this new partnering regards to Poseidon, your data lake that is so amazing, and we intend to build something alike here in our country. So international partnership in the oncology division at Einstein was never so good. So with these words, I thank you for that.
We appreciate it as well. Thank you. Dr. Bosserman, really a collaboration by definition means both parties are benefiting. Can you talk a little bit about what City of Hope is seeking and obtaining from collaborating institutions like the Einstein?
Thank you. We serve, our region, 10 million people in Los Angeles, another 4 or 5 in Orange County, and, several of the counties, about a 25 million PO area. But that's just a very small part of the world. Really being able to work with our Brazilian and other colleagues means that we have access to patients everywhere who have different needs, different genomics, different opportunities to learn and develop together. We have a very large precision oncology initiative. We are privileged at City of Hope to be able to test all of our patients who consent for both germline and somatic mutations. We're hoping to be able to extend that in our partnerships, but then to be able to analyze, and as Dr. Sergio says, share the ability to build these large databases and learn from genomics, learn from different populations on new treatments, new challenges, and better ways to cure and treat cancer. So by really working with colleagues, we expand our ability to do science with them, and then learn from them, they learn from us, and really extend research, as well as the opportunity, as Dr. Sergio mentioned, to do unique things without building multiple centers doing the same thing so that each center is optimized. I noticed when Dr. Anderson mentioned that in very few countries do the public and private sector work together. We have that model at City of Hope, reaching out to our Martin Luther King population, our county population in the most underserved areas of California. Just like Dr. Sergio mentioned, they've developed the public-private partnership from HIE to the city so that all patients have access, but that means we also have access to them to do understanding of their tumors, how to be innovative in treatment, but also how to develop new treatments based on genomics and precision medicine, so that ultimately we found better treatments, less toxicity, and could optimize that access to patients. It doesn't help if we all have great treatments, but we don't have new innovative ways to provide access to it and affordability. So we have philanthropy, the Albert Einstein has philanthropy, and we're looking at how to optimize that for discovery and for treatment, as well as improving cures and support of patients and their families. As I mentioned, we have a renowned genetic training program that has been able to be remote and to be able to train more people on genomics, precision medicine, and genetic counseling through our remote services is another great opportunity to expand that opportunity to Latin America through our colleagues, and then train them to train the trainer, and then just build the programs. One person trained doesn't mean you have a program that's effective in an area, as Dr. Anderson pointed out in his first talk. So our ability to work together, build those relationships that are trusting and collegial, really leads to the innovation in care and services and research together that can provide more cures and expand access to patients. So it's those types of things. Yes, it enhances each of our reputations, but it's about this privilege of taking the training we've all been so lucky to have and sharing it effectively to improve access, care, and research throughout the places that we are lucky enough to collaborate with.
Well said. Let me go back to Dr. Sergio, because a very, very interesting development is the Park Global project, which essentially is a very large development, and the central feature of which is going to be a dedicated brand new cancer hospital run by the Einstein. Is that correct? How do you see that, Dr. Sergio, helping to elevate cancer care within Brazil and perhaps beyond Brazil?
Yeah. And as you know, we are a general hospital. We are a 50 bed hospital, and we are today 107% full. So our oncology needs to grow. That was the first driver of that. The second, so we had to reach a decision of which hospital to build. Another general hospital, our society, the Albert Einstein Society, had to take a decision. We would be building a new general hospital, or we would be building a specialized hospital. So we look at our opportunities, and we have decided, the board have decided for a cancer center. And so it's going to happen here in São Paulo. The project already, the contract has signed, and the project will be ending, I believe, in 2027. It will be a 150 bed hospital close to here, like 15 minutes from our main campus. And what do you intend to do there? We were talking this week before about several things. Well, first of all, it's to expand access to patients who already can be treated at Einstein. So we intend to provide more spots for them. Second, we would like to increase the access profile of our institution in the supplementary health system. Third, since we are as the Brazilian government say, an excellence philanthropic hospital, we are able to develop projects to treat patients in high need of treatment, like, for example, radiation therapy, bone marrow transplantation, or surgery. And then we were talking with Dr. Linda, Roxanna, and Ed about proton therapy. And an example that it's not in the final plan. However, it's in the preliminary plan. And why would be that? Well, because like if you see the eastern coast here in the US, when we visited you guys, and then we went to Baltimore, and in the range of 60 kilometers, they have 3 proton beams there. We have none in the entire South America. So regardless of the small range of indications that we have for this treatment, it's our mission to try to provide some, since no country in South America have a proton beam. So we are studying this possibility. The other thing that we can do is to increase access to non-payers, Brazilians, and not Brazilians only. As a matter of fact, everyone who is inserted in our system, they do not have to be Brazilian. They can have access to our health system according to a chronologic wait list. We can do some special programs inside our private hospital. This can happen. It's already happening. So I think by increasing the number of spots, increasing the amount of people that we can, as we say in our mission, take a small drop of Einstein to them, and by doing specialized programs, mainly based on research or in technology that we currently don't have in our country, through our partnership, like CAR T-cell therapy that you are amazing and you are strong at, we think it will be, that's why we decided to build a cancer center.
Beautiful thing. I think we're getting close to the witching hour on time, but I wanted to pose at least one more aspirational question for you. And each of you are welcome to answer this. We all start with Dr. Bosserman. What would you think would be, if we were dreaming, we could do together further in the future with the Einstein and perhaps with others as well to elevate global cancer care?
Well, again, I think we're really looking at the cutting edge of the future, and to be able to build genomic, germline, and somatic testing as a reality for patients with tumors in any place that we can collaborate and have the informatics and the analytics to really understand that for new discovery would help people everywhere. We've seen that at City of Hope, where different populations of lung cancer patients had new mutations, led to a new treatment, and that's in multiple different cancers. We're seeing that story. So to work with collaborators, to be able to have the genomic testing done and work together on the informatics in really in an informative way that can lead to new treatment, I think that's a really exciting future.
Roxanna, let me turn to you and ask the same question.
Yes, I think it will be extremely valuable for international hospital and entity collaborations to offer free remote second opinion consultations for patients in the underserved countries. And also in the same time, offering clinicians to receive specific oncology training to advance their skills and knowledge through grant funding and philanthropic donations. In returns, these oncology clinicians will continue to stay and provide cancer care for patients in their hometown and home country. So through these collaboration efforts, we can minimize the gap for access, equity, disparity globally.
Before I jump to you, Sergio, for your thoughts on the aspirational question, there's an audience question here for Roxanna, I think.
Yes, I think that what we dream of, here at Einstein, we are an institution driven to 3 main things: teaching, education, and healthcare. Regarding our education division, we have 40,000 students. They are mainly divided under graduation systems, short duration courses, master degree and doctor degree, and specialty courses. We think the thing most important to us is our brand and our value. and it's well recognized here in South America, here in Latin America. So there's a lot of institutions and countries, they're in need of medical expertise, mainly in oncology. It's well known that South American and many Latin American patients are underserved in basic oncology services like radiation therapy, surgery, and even chemotherapy. It is our dream that by doing what we are doing with you, we could extend the kind of excellence that we are receiving from you to other South American countries, like we being a hub for CIM at City of Hope. And what we could provide here under your supervision, we would provide. And what cannot be provided here will be provided in California. That's what we think. This is a lot of work that in order to devise this new scope of action. But I think from what we have seen since we started our partnership, it's fully possible.
That's going to keep me up for the next few nights thinking about that one.
Okay.
I think I'm going to conclude with that, except for one, or allow any additional questions from the audience. I think there is one we wanted to put up there. I think for Roxanna, this might be for you. What are the most common diagnoses and treatments that cause patients to seek care at City of Hope? Can you talk a little bit about our patients that come in from overseas?
Yes, Ed. About 40% of our in-treatment patients here are of Chinese ethnicity. During the pandemic, we have observed more new country patients traveling to US for cancer treatment. And many of the international patients are looking for innovative treatment, flu clinical trial, because that's not available at home. And patients with leukemia, breast cancer, lymphoma, GU, colorectal, and lung cancers are looking for clinical trial, EMT, CAR-T, and other cellular therapies. Some of the patients actually come here because they have family, they live here, and they come here for the care because they want to be with family during the treatment. And in the Southern California, City of Hope is in the center of a very diverse community with multiple culture and ethnic backgrounds. So patients decide to receive care because they feel a sense of home here.
Very good. And so I'm going to ask Candace if there are other questions that we could take from the audience. And if not, we can pass it back to Dr. Ogembo.
There are any additional questions at the moment?
Well, thank you very much. It's been a very interesting discussion, and we hope we contributed something to the overall program. Thanks very much.